Hello, my name is Sharon Mosguy. Today I'm presenting User-Centered Design for Mobile Health Applications, a military case study in rapid assessment process. This work was done with my collaborators Brian Feminello, Arno Hartholt, and Albert Skip Rizzo at USC's Institute for Creative Technologies. Currently, U.S. military leadership is ranking the well-being of soldiers and their families above combat readiness and even weapons modernization. Emerging mental health or mHealth technologies designed to support mental health are considered a promising tool for overcoming stigma and engaging service members in their own care. This rapid rise of interests makes sense. These apps can transform mobile and wearable devices into a monitoring and therapeutic platform that can capture mental health symptoms in real time and deliver on-the-go mental health support. Despite the widespread consensus that identifying the needs and perspectives of targeted users is a vital component in good intervention development, user-centered design has not been widely applied in the domain of mHealth applications. The purpose of our case study is to report on the user-centered design process we employed in the development of the mHealth application BattleBuddy. BattleBuddy is designed for a military audience, and it leverages sensors native to popular smartwatches to deliver adaptive multimedia wellness content via a virtual human coach to drive engagement. The ISR framework depicted here was used to guide the overall app design. For today's short talk, I'm going to delve deeper into our team's use of rapid assessment process as part of the design cycle of ISR. RAP is a qualitative research method borrowed from participatory action research. The goal of a RAP interview is to have people tell you personal stories and about their experiences. RAP teams should be multidisciplinary, but RAP interviews with end users should be conducted by an insider to the end user group. These interviews follow a series of guidelines rather than scripted questions. The primary aims of our first RAP interview were to identify the mHealth needs of this community, their mobile app preferences, and identify any barriers. The insider who conducted our end-user interviews was a U.S. military cadet. The interviews were one-on-one, approximately 60 minutes in length, and videotaped. All participants were exposed to the same BattleBuddy functionality during the sessions. Our target population was U.S. Department of Defense personnel, or those who live with military personnel over the age of 18. We recruited 10 participants, as previous work in RAP shows that themes begin to repeat themselves after about 8 to 10 interviews. I'd like to give you a closer look at the app and those end-user interviews now.
Remember, research suggests that reflecting on the good things that happen in our lives can affect us positively. I'll give you a few moments to think. And when you're ready, hit the microphone icon below and begin to speak. Just hit the microphone icon again, and then the next button.
The soldier looks very real. The crease lines are incredible. I feel like I'm talking to a real person, so bravo there. It's just coming down to the fact that I don't feel like I'm talking to someone in my unit, and having those patches will allow me to feel more comfortable with who I'm talking to within my respective unit.
Our team coded this data from the interview transcripts, and we divided it into thematic units. A coding system was developed based on the recurrent themes that came up. The transcripts were double-coded using NVivo 12 software. The RAP team then worked together to consolidate relevant findings from the codes through the synthesizing of patterns. The findings here are specific to our app. I did want to share them, and I would like to share how our app evolved because of these findings. So lessons learned from engaging in this process is that it's cost effective. The themes emerged quickly across interviews. The insider interviewer led to quick disclosure from our participants, and the personal stories they shared lacked excessive exposition. They got right into it without defining a lot of terms. Our a priori interview guide was invaluable for covering all of the topics that we needed to across interviews because they did all take their own shape. And the end users are really savvy about their design preferences, even if they aren't designers themselves. RAP can also lend itself to traditional UX studies like Think Aloud exercises, and we think that there's applicability outside of our own lab for this process. We did have limitations in our study, small sample size, lacking diversity, demographic and geographic, but if you'd like to speak to us more about any of this, you can reach us here. Thank you so very much.